This is Dr. James with Helpmommy.com, and today is video 5 of 5 about a 6-month-old. And we're going to talk about the physical exam and what you see when you come to the doctor, and what, as on the doctor's side, what we're looking at. So the first thing we're going to be looking at when your baby comes in is growth. So in the weight department, your baby should be at least double its birth weight. We're going to be looking, of course, at growth as far as weight and height and head circumference. And when we're telling you these growth parameters of like your baby's at the 20th percentile or the 50th percentile, the 75th percentile, those numbers are really there for you, just so you know how big your baby is compared to everybody else. But those numbers are pretty meaningless in the big scheme of things. A baby can be completely normal at the 10th percentile as the 90th percentile. That doesn't mean that your baby is more or less healthy or more or less good. We're using these curves to really compare your baby to your baby the last time and making sure that we're having appropriate growth in both height, weight, head circumference. We don't want to see sudden changes, especially them dropping off, or in the case of the head, dropping off, or sudden acceleration of head growth, because those can indicate things that are bad. But to be honest, where your kid is trending on that curve, I don't really care. And it really doesn't matter as far as how big they're going to eventually be. People place too much meaning on these percentiles. But really, it's just kind of a fascinoma for you to know how big is my baby compared to the rest of the babies in the world. And to be honest, it's not even in the world. Those growth curves are based off some generic white people in the United States. So if you have any ethnic diversity or anything like that, there's actually curves that are made specifically for different races. And so there's just people that are going to grow at different rates and different sizes. And so you can have specific growth curves for those. A lot of times we don't do that, but they are available. The next thing we're going to look at is how your baby's eating. We still want them to be on either formula or breast milk. And this is when we start introducing foods. And so they're going to talk about that. They're probably going to emphasize stay away from things that can choke your baby and still stay away from honey. We're going to talk about development. Your baby should definitely be watching everyone, interacting with everything, smiling, laughing. They should be able to at least sit with support. That means cramming you up in the corner of a couch or putting you in a boppy, being able to hold up their head. They should be reaching for things, and they should be rolling. The next thing that we're going to talk about is baby proofing. Getting your house where it's all safe. And we've had a video that's specifically made for that. Then we're going to examine your baby from head to toe. And the things you're definitely looking at this age is, are our eyes crossing? We don't want that to be happening anymore. Of course, we're going to look at ears. We're going to look at mouth. We're going to look and see if we have any emerging teeth. About half of the kids have a tooth by the time they're 6 months old. Usually while we're examining the teeth, we're going to talk about teeth care. And usually with teeth, we just want to wash them with either gauze or a washcloth here in the beginning when there's only a tooth or two, and start using soft toothbrushes when they have teeth on the top and bottom, usually just using water to clean their teeth. Then we'll, of course, listen to their chest, make sure they don't have any murmurs, their lungs are clear, feel their belly, make sure there's no masses. Look at their bottoms, make sure we don't have any rashes, make everything sure everything's there, and all their arms and legs are working fine. Then we're going to talk about vaccines. At this age, this is actually usually the last time that we're going to get shots in their first year of life. And these vaccines are typically the same vaccines as they got at 2 months and 4 months. And so usually we do not expect any new or unusual side effects. At 6 months, it is when they can start getting a flu vaccine. When you're going to get a flu vaccine your first year of life, there are 2. You get one and then you get another one in a month. Now, flu vaccines are not available year-round. They usually start becoming available in usually August or September, and we usually give these through the fall and the winter months. But that first year of life, just remember that you get 2. Every year after that, you only get 1. Even if you only got 1 your first year of life, the second and subsequent years, you only get 1. But usually with these vaccines, we don't see much as far as side effects other than local effects, where sometimes they can react just to getting a shot necessarily to the vaccine. Then we're going to talk about our anticipatory guidance, what we see coming up in the future. And we talk about usually the things that are going to get them in trouble. The fact that they're moving around a lot more, they're grabbing a lot more things. Food is going to be advancing, a lot more problems with choking. We may talk about what you would see if you had an allergic reaction to a food, like hives or problems breathing, and how to handle that. But that is basically a 6-month checkup. Hopefully this helps you to at least know what's going to happen when you go in so that you can plan and get your questions all in order so that you can ask the appropriate questions when you see your pediatrician.